So for the first of the 5 pain provocation tests, we are going to be performing the distraction test. So what we're going to do here is we're going to find patients both ASIS. We're going to cross hand, and we're really just going to press straight down to distract. And if there's any pain with this test, it's a positive test. So for the second of the pain provocation test, we're going to be doing the compression test. So we're going to have the patient's knees flexed to 90, hips flexed to 45. We're going to take both hands over the anterior rim of the ilium, and we're just going to press straight down through here. If there's any pain with this test, it's a positive test. So for the third pain provocation test, we're going to be doing the thigh thrust test. So we're going to take the patient's symptomatic side and flex the hip up to 90 degrees, and we're going to have some slight adduction. We're going to come underneath onto the patient's sacrum, and then we're going to apply an axial force straight through to try and distract that SI joint. If this provokes any pain, it's a positive test. So for the fourth pain provocation test, we're going to be performing the sacral thrust test. So what we're going to do is we're going to take our hand, we're going to put it over the S2 spinous process right here, and then overlap with the other hand, and we're just going to press straight down. And if that provokes any pain, that's a positive test. So for the fifth and final pain provocation test, what we're going to perform is the Gainesland's test. So what we're going to do is have the patient bring their symptomatic side up to 90 degrees of hip flexion. Basically just try and bring that thigh all the way towards their chest. We're going to take the left leg, and we're going to bring it off the table like this. Then we're going to provide a counter force between the thigh towards the chest and the other thigh towards the ground, and just push in opposite directions like this. If this provokes any pain, it's a positive test. And then we would test the other side to see if there's symptoms on that side as well.